Hey everybody, so I want to continue our knee pain series with proprioception this week. So we talked a little bit about muscular strength. How do we get that change? How do we build the strength, right? This second function I want to bring up is called proprioception. Really, that's a fancy word for body awareness, or how efficient your nerves are working in a certain body part or a total body focus point, right? So as far as proprioception, why do we need it? Let's say you're walking down the road and all of a sudden you hit a slippery piece of ice, right? So that slippery ice is an external factor. Your body loses traction, you go for a fall. It needs to be able to sense that change really quick. That is proprioception. For our athletes, especially the young ones in here that are learning how to move, control their body, still building their performance, speed, strength, all that, their proprioception needs to keep up with that. Otherwise we see a lot of overuse injuries, or they're running so fast that their hamstring strained, right? It's not really aware of how long that position is in the hamstring. Ankles rolling them, right? That's literally proprioception most of the time mixed with a little strength. And so what we want to do is to elicit proprioception, and that literally can help solve a lot of the knee cases that we see. In combination, if we don't have proprioception, we're not going to have strength. Flexibility is going to be guarded, right? There's a neurological reaction that happens, and muscular endurance just won't be there because we don't have all those other factors needed to even build muscular endurance the right way. So proprioception is huge. It's all of these factors wrapped into itself. So I wanted to go over how do we test for it, what do we really look for when we're training it, and so forth. So one of the things I like to do, I'll show you real quick, is get people to sit down. That's the most common way of doing this, and just get in any position, right? So again, proprioception is your awareness, your balance, your sense of space. So what I want you to do is close your eyes, take your pointer finger, and touch your big toe. So that's awesome. That's crazy right there. I missed my big toe. That obviously didn't match what my visualization was. So let me do that again. Better. Okay, so I touched my big toe. Okay, we should be able to touch our big toe. It's funny, I have some knee issues that are starting to present themselves, and that probably tells me a little bit of that proprioception is missing there. All right, so again, you should be able to close your eyes, visualize what's going on, and understand without seeing it where you are. So without doing a crazy anatomy and physiology lesson here, we have two factors in proprioception, two big ones, right? And we have sensory nerves, which gather information from our external environment. So for an athlete, you're running, you know where you're running, right? So it's aware of your body position, or at least it should be, without even having to really need to think about it. So it's gathering all those information signals and sending it to our brain. Then we have the second part of proprioception. And what that is called motor units, or motor nerves, right? So what happens is we get all the sensory information on our environment we're in and our position we're in, and then when our brain has to interpret that and send the signal to the muscle to make a movement or to make a reaction. So if I'm an athlete, I'm running, I'm getting tanked by this guy beside me, or at least I get a glimpse of him about to hit me, my body makes the appropriate senses, it makes the appropriate adjustments based on that sense. So that's a basic sense of how we can prevent injury with proprioception. For chronic knee pain and so forth, we have pain nerves, and those pain nerves do have a function, right? There's diseases out there where people don't feel pain, and that is way worse than feeling pain. There's horrible things that usually don't make it past the age of 25, which is kind of crazy. So what happens is we should feel a normal sense of pain. Our body interprets that sense of pain and cuts it off, right? And calms it down once it realizes there's no immediate threat. And again, this is a very broad brush I'm using here. But that is a sense of why chronic pain can happen. So if we reteach and reprogram proprioception in the knee or any other painful chronic joint, what we can start to see is that it learns healthy function again, right? And with a fancy word for that pain response in the sense of proprioception is called nociception, okay? And so we'll go over that for sure in another video. I'm really intrigued by that and try to teach a lot of that aspect in here, and foam rolling goes into that. But foam rolling can be used to enhance proprioception, believe it or not, okay? Today I did want to talk about our CNS dot system we use here for a lot of people. Back in the day I used to use pieces of tape for this on the ground. And it doesn't have to be rocket science, you're creating targets for you to reach and touch, that's about it, okay? I put the center dot here, that's the one you're going to stand on one foot. I'll show you everything in action here in a second. put another one about 6 to 8 inches away, put another one about 12 inches away, and another one about 16 to 20 inches, right? Believe it or not, these closer dots, what I call them level 1, if they're really close to this dot, it's gonna be very difficult. So definitely go 6 inches at least, okay? So I do a level 1 arch, a level 2 arch, and sometimes you can even do a bigger one. And the cool thing about these dots is you can use them for what we're about to do, but they have so many other purposes. We use them for warm-ups, for reteaching proprioception, obviously, and also getting stability and muscular endurance in those stabilizers and all over the body, mainly the lower body. So we also even use it with plyometrics, which is pretty cool. We'll definitely do something on that one day. So what I want to do is have my eyes open for this. I'm going to stand on the middle dot. The side of the body that's standing is going to be the side of the body that's reaching. So I want to reach that dot, find my balance, touch it with my toe. Reach that dot, touch it with my toe. Now when I'm touching, I don't relax and brace myself as much as possible. I treat it as if it's a hot coal, okay? So I just barely touch it, and then same thing with the foot, barely touch it. We don't want to relax. All of our weight is on this guy, right, the working leg. So I want to stay on that leg and do the dot and target reaching for about 90 seconds. Studies show us that 90 seconds of skill work, even in gymnastics back in those competitive days, they want to teach you stuff for a given amount of time, and we'll talk about that. But 90 seconds on each leg, again, eyes open for this one. I'm going to show you one with eyes closed here in a second. And what I want you to do is really, really, really focus on quality. Do not rush into saying, hey, I can get 100 dots, right, in 90 seconds. That has nothing to do with it. I'd rather you touch one dot without touching your leg on the ground than touch 20 dots and have to hit your leg every single time, okay? So go for quality on this one. All right, real quick, the next thing I want to show you, I have an AirX pad here, which is probably my favorite because it's the safest to do this with. I've got a spree disc, right? We've got a rocker board. We've got all these fancy tools for balancing. And what we want to do is before we use those, which they are great challenges, we do want to get used to it without any sort of challenge, right? We want to be able to do the basic function before we make it crazy hard. So one way I want you to do this, remember when I did proprioception and I went to touch, and it's actually funny, I missed it, right? So I need to work on eyes closed proprioception. That is simply, where am I at in my surroundings? What's the position of my joints, okay? And so the way we do that best is I'm going to close my eyes before I lift my leg. I want to gather my sense, right? I want to get used to that. And then what I'm going to do, and one little secret, I'm visualizing, I can't really see it because my eyes are closed, obviously, but I'm visualizing a set spot on that wall. And I close my eyes, get used to everything, then I lift my leg. Okay? And we want to sit there and balance, again, as little time on the ground as possible with the other leg, but over total, I want to go for 90 seconds. Okay? And that gives my body enough time to learn from that exercise. And I want to make sure that my arch of my foot is off the ground, the front ball of my foot is on the ground, my big toe is pushed into the ground, and a lot of the weight is distributed outside and towards the heel of my foot. Okay? The other thing we want to look for is that our knee is rotated out. That gives us healthy arches as a Latin effect, as a secondary effect. So, with all of this said, we know that it takes 90 seconds for a change to occur, so let's call that a rep. So one rep with this is 90 seconds. Then we want to do, as far as what people think of as sets, we want to do whatever it takes for 10 minutes worth of effort. So I would go between these two exercises and set my clock for 10 minutes. And again, 90 seconds, 90 seconds, 90 seconds, 90 seconds. Do it for 10 to 15 minutes a day. And that means that every single day has the highest improvement when it comes to looking at studies and how these brain centers do this. So what I want you to do, practice every day. Once you get really good at it, you can shift it to 3 times a day, or 3 days a week, sorry. On top of the strength training, we're going to go over flexibility and muscular endurance later this week. So if you have any questions, if this stuff just isn't working for you, I want you to reach out to us right away. We don't mind answering some questions over Facebook or website, whatever is best for you. Feel free to give us a call. The other thing I want you to do is if you have pain during any of these exercises or movements, like this one, let's say that I come here and rehab is recent, or I'm still going through that acute injury. If this hurts, let's work on this, right? We want to poke the pain. We don't want to feel it crazy, but we want to get to where this doesn't hurt before we go reaching. So we're huge advocates here of progressive overload, right? So we're going to go through these things in a strategic stepped plan. So again, reach out if you have any questions. Stay tuned. Please share this with anybody you think of that could use some knee pain help. We are here to really get our community out of pain and start learning all the resources that we have to offer. Thanks guys, take care.